Perceive, process, perform. Do you need inspiration for your practice? Or do you simply need to practice inspiration? With this series, we aim to do both. Give us 15 minutes and we'll give you practice inspiration. Although Dr. Lauralee Nygaard has a strong and well-deserved reputation from her peers as a periodontist who provides exceptional smile-enhancing procedures and truly cares about her patients, today she'll be talking about something far more important: flossing away cardiac risk.
It was the afternoon of May 25th, 2005. I was in the middle of performing a connective tissue graft surgery when one of my study club doctors dropped in to ask some treatment planning questions about an upcoming case. My patient was not sedated, and I felt she could benefit from a break. So I placed some gauze, told her to close down and rest her jaw, excused myself from the operatory, and met with my colleague for a consultation. I returned 5 minutes later, sat down in my chair, put on my loupes, looked down at my chart to focus, and froze. In an instant, the images on my chart vanished from my sight. I thought maybe there was something wrong with the focal length of my loupes and started to rock my head back and forth. Still, I could see nothing. Not darkness, no spots, just snow, TV snow, like I remember seeing back in the day when the late-night movie once ended. Being the control freak that I am, I commanded that my brain focus my sight. Still, I could see nothing. Now, the analytical geek kicked in, and I theorized if I was commanding my brain to do something and nothing was happening, there must be a problem with blood supply. I made a conscious effort to evaluate my symptoms. I moved my hands and moved my feet. I didn't have any nausea, and I had no headache pain. My heart rate was not elevated. I did not feel my life was in danger. I felt like this was some weird neurologic event. I suspected a blood clot and knew I needed some aspirin. I was able to turn around in my chair, stared blankly at my assistant, and considered momentarily asking her to call 911. But I was worried the patient that was not sedated might be concerned. I was able to turn my chair around, excuse myself to the bewilderment of my assistant, and walk blindly down the hall to sterilization and the medicine cabinet. Once in sterilization, I asked my assistant for 2 aspirin. I told her I didn't feel right. I was able to chew the 2 aspirin and put them under my tongue. I asked another assistant to take my blood pressure. 90/60. That's weird. That seemed normal. And by now my vision had returned, so I headed to hygiene for a patient exam. I greeted the patient and heard my hygienist excitedly ask if I was okay. I thought that was weird. I didn't realize by now my speech was slurred. I left the hygiene operatory and headed back to surgery and sat down. I tried to pick up my needle holder, and while I could move my hands, my motor skills were gone. My assistant helped me put the needle holder in my hand and helped together guide my hands so we could tie the last 2 sutures. I felt a sense of relief. I had finished the surgery. This was my last patient for the day. I excused myself and headed to my front office to talk with my office manager, who had now heard from several concerned team members that something was really wrong. She asked me how I was doing. I told her I was fine, but that I wanted to go home, and she asked me for my car keys, which struck me as a bit odd. She told me I was not driving myself home, she was driving me home. And I started to argue and then thought I was just grateful I didn't have to think. I was happy to accept the ride home. Later that night, I remember laying in bed, being afraid to close my eyes. I remember wondering if I closed them, I wasn't sure that they would open the next morning. The next morning, my husband drove me to work and hung out for a few hours to see how things were going. He scheduled an appointment with my physician for that same day to have me evaluated and shared later that he was terrified because he knew I was not responding normally as I normally did. At the doctor's office, he asked me lots of questions, had me walk a straight line, had my eyes follow his hands, and told me I had had a migraine. I emphatically told him I did not have a migraine. I knew it was a neurologic event. Being a little bit annoyed with me, he said, "Fine, we'll do the MRI just to prove to you that it was a migraine." 3 days after my MRI, I received a call from my physician who told me the radiologist had seen a spot on the MRI. He told me not to worry. He was referring me to a neurologist who was booked out for 6 months, but who had agreed to see me during his lunch break the following week. For the next several months, I had multiple clotting disorder screenings, 3 additional MRIs, 2 with dye contrast. I had 3 echocardiograms, and at the follow-up appointment at the neurologist, he told me my diagnosis was a cryptogenic stroke, not a TIA, a full-blown hemorrhagic stroke. Cryptogenic because they didn't know why. And in all of his years of practice, for all the tests he had ran me through, he said he had no medical reason for my stroke, that all the tests came back normal. He was astonished that I had the wherewithal to chew 2 aspirin and most certainly believed that that had saved my life. He handed me his business card, told me to take a baby aspirin every day, and said to call if my symptoms returned. I left his office confused, frustrated, and terrified. I was 37 years old. I had been in excellent health up until this time, had never had a serious illness, and had only missed work after the birth of my children. I knew there had to be a biologic reason for my stroke. So I started sharing my story with my patients and came to learn that there was a heart attack and stroke prevention clinic in my town run by a physician. I knew I needed more answers and felt that this was where I needed to go. At a follow-up visit with my family physician, I asked if he would give me his blessing. I didn't want to offend him for trying to get some answers, and he had agreed that he thought it was a good idea. At the Heart Attack and Stroke Prevention Clinic, they collected all the results of the tests that I had done, and in addition, sent me for another blood test called the Berkeley Heart Lab. They taught me that arterial plaque does build up within the arteries, and it can cause narrowing of blood flow and obstruction, but the most deadly part of heart disease was when arterial inflammation caused the plaque to rupture, allowing a clot to pass through the artery. If the clot passed through the artery and lands in the brain, it's diagnosed as a stroke. If the clot passes through the artery and lands in the heart, it's called a heart attack. But at the core of both of those diseases, vascular inflammation was a key player in plaque rupture. I further learned that there was a blood test that could monitor an enzyme called LPPLA2 that could tell you if your arterial inflammation was elevated and if your plaque could be at risk of rupture. Therefore, you could have some knowledge if you were at increased risk of heart attack or stroke. I learned that cholesterol testing alone isn't enough. 50% of heart attacks happen in patients with normal cholesterol, and that my cholesterol was normal 30 days before my stroke, and my stroke was really the first sign I had any kind of disease. With the Berkeley Heart Lab, they were able to diagnose me with a genetic malformation in one of my cholesterol particles that did increase my risk of cardiovascular disease. It wasn't some accident that I had had a stroke. I was young, fit, incredibly healthy, and had cardiovascular disease based on my genetic cholesterol makeup. They told me that they were going to begin me on a pharmaceutical regime, which included aspirin, a statin, niacin, blood pressure medicine, and vitamin D, and that I was going to be put on a 3-month blood monitoring program so that we could evaluate what was going on with my cardiovascular inflammation and make appropriate diet, lifestyle, and medication changes to fight the disease. They sent me to a nutritionist because I had to learn to eat a cardiac healthy diet. They also counseled me on how much exercise I needed to get every day. And for a few years, my blood chemistry stabilized and things were going well until December of 2009, when at a follow-up appointment with the prevention clinic, they noted my plaque-2 marker, which again is risk for vascular inflammation, had gone from 161 to 191, or pardon me, 119 to 191. It was a 62% increase in the plaque-2 marker in a short period of time. And while less than 200 is normal and 223 is high risk, because there was a 62% increase in this inflammatory marker in a short period of time, and with my history of a stroke, the prevention clinic was concerned. The nurse asked me what my gum health was like, and I laughed and said, "Excuse me, do you know who I am and what I do? I'm a periodontist. That's a gum dentist, and I can assure you I do not have periodontal disease. She ignored my response and asked me when was the last time I had my teeth cleaned. Reluctantly, I had to admit it had been about 3 years. And while I did brush my teeth every day and floss fairly regularly, I had always had pockets that were 2 to 3 millimeters, with maybe only one 4 millimeter pocket here or there. I was never even taught to consider that as periodontal disease risk. She told me that they suspected that oral infection could be spiking my plaque 2 marker, and they wanted me to take an oral DNA test, which is a test that assesses genetic susceptibility to periodontal inflammation and also identifies high-risk and moderate-risk periodontal pathogens. I told her this was ridiculous, that the mouth was full of bacteria, genetic testing wasn't going to show anything, and that I knew I didn't have gum disease. But the risk of having another catastrophic event and knowing that I had really gotten lucky the first time drove me to consider taking the test. And so I finally agreed to take the oral DNA test. And when the results came back, I was not surprised to find out that I was genetically susceptible to periodontal inflammation. Many patients with cardiovascular disease also carry that genetic susceptibility. But what was a huge surprise to me was that with my entire mouth, probing pocket depths were 2 to 3 millimeters. I had one 4 millimeter pocket on the distal of number 30 and one 4 millimeter pocket on the mesial of number 31. Those were the only 2 sites in all of my mouth which bled on probing. And they found on the test high-risk periodontal pathogens, Actinomycetum commentens, present above threshold levels. This shocked me. I had seen thousands of patients who looked healthy like me that had one 4 millimeter pocket that bled, and I never once discussed periodontal disease. So I had my teeth cleaned and started flossing my teeth every day. I was going to prove to the prevention clinic that this was ridiculous. So I flossed faithfully, had my teeth cleaned, and the plan was 6 weeks after my tooth cleaning to do another blood draw to check the plaque 2 marker. I wasn't holding my breath. I was expecting the plaque 2 to be elevated, and I was anticipating more pharmaceutical therapies to come my way. 6 weeks after my cleaning, when we got the test results back, I was able to drop my plaque 2 marker from 193 to 161. And on the Berkeley Heart Lab worksheet that comes with you, that dropped me from high-risk stroke to the normal area. And my test results really challenged my thinking. I had realized that I had seen a lot of periodontal inflammation that I had never really recognized as disease. I started treating my patients much more aggressively for even smaller amounts of periodontal inflammation. And while I was sort of taught to think it took a lot of infection in the mouth to have systemic footprint, I was starting to think a little differently. I realized that in the right host, even very small amounts of oral inflammation could be significant drivers of a potential plaque rupture. And that if I shared my story with patients and gave them the opportunity to know what their genetic susceptibility was, that maybe I could prevent somebody from going through what I had gone through. And so it's for those reasons that I share with you my story today. I hope to encourage you to be challenged in your thinking, to be inspired to advocate to treat even the smallest amounts of oral inflammation, and more importantly, to share with your patients that you can provide for them life-saving dentistry.